Hi, everyone. Thank you for joining us for an evening with Dr. Rubino. We're going to be talking about some summertime vaccinations and how to stay healthy this summer while you're outdoors and having a good time. Dr. Rubino, are you able to describe what you do and your background a little bit?
Sure. I'm Ida Rubino. I'm a family physician at Corewell Health, which is the new name for Beaumont. I do practice care at the location in Troy, and I see all ages. So we do a lot with vaccines in our office. And I also teach at OUWB, which is Oakland University William Beaumont School of Medicine.
Wow, thank you. Thank you so much for being here and loaning us your expertise. Our first question is about the main vaccines that you should consider for yourself or your kids this summer before doing a school sports camp or something similar.
So I think that would depend on the age of the person. In my opinion, vaccines are really one of the best forms of prevention that we have. The reason people may not realize the importance of vaccines at this point is because we've eradicated some of these very dangerous diseases. And so we have this perception that the vaccine is worse than the disease, which is so untrue. In this generation, we don't see things like polio, or we do see measles, but not as much as we used to. So there's this perception that, hey, I don't need that vaccine. But I think if a child or an adolescent is caught up on the routine recommended vaccines, which are according to the schedule that is put together by the CDC as well as other organizations, then they should be protected for the summer. Same thing with adults. We have a very good schedule that comes out every February. A group of experts meet throughout the year and they collaborate and they review the science. And they put together this schedule that is updated annually. And those are the standard guidelines or recommendations that healthcare providers follow. So specific to the summer, there's really not much like we would see in, say, flu season, for example. But I would say it's age dependent and according to that standard schedule. So if there's any delay in any of the recommended routine vaccinations, that would be important, especially because people are home, they're outside, they're with other people, they're traveling. And I know we're going to talk a little bit about travel later, but there may be exceptions to that routine schedule where there might be some special circumstances where additional vaccines would be needed.
Okay, thank you. And this kind of goes into that with the weather being warmer and we're able to spread out and not be as close to each other. Do vaccines really matter as much as when we're indoors in the winter and fall? Do they really help to prevent as much disease as like in the summertime as they would during the colder parts of the year?
Oh, absolutely. Yeah. If you think about kids and adolescents, even when they're outside, I know you're in the fresh air and maybe you're not in a closed area, but they're very close together and they're sharing drinks and sharing food and maybe kissing or doing other things. So there still is that close contact. And many viruses are transmitted through respiratory droplets, as we've learned through COVID. Some may be through bodily fluids. Some are sexually transmitted. So there's definite risk factors that we look at that may not have anything to do with whether you're outside or indoors. It could be more related to certain high risk type behaviors, which we might see in older children or young adolescents, even with adults. So I think it's equally important. The other thing to consider is that certain viruses, certain illnesses have a seasonal variation. So some may be more prevalent in the summer, some may be more prevalent in the fall, like influenza, or the winter, like influenza. So I don't want people to have this perception that they're completely safe just because they're outside, because there are other risk factors to consider.
Thank you. Where can someone go to find what vaccines they need or their children still like what they still need to get?
For anyone out there who's my age, you probably remember that green vaccine card that we used to carry around, and I still have mine and I can still read it before the days of the internet. But now we're fortunate. I think Michigan has one of the best registries nationally. The abbreviation is MICR, and it stands for Michigan Care Improvement Registry. And healthcare providers are required to enter any vaccine that an individual age 20 and younger gets within a certain time period, so that we have this state registry with all the vaccines listed. And even though it may not be required for people older than 20 or adults, it's still highly recommended. So we've really mastered this system where we put in vaccines, it's on the state registry. And the nice thing is we can now link it to many electronic health records. So for example, if somebody gets a COVID booster at a pharmacy, it will likely show up on the electronic record at their doctor's office. So people can go to their healthcare provider. They can request a copy of MICR or the registry, which will give them not only all the vaccines they've had, but any that are recommended, especially for children and adolescents. And schools even have access to that schedule. So there are certain points where vaccines are required, for example, starting kindergarten, starting middle school or sixth grade, or even starting in a new school district. So the schools will then access MICR and review to see whether the individual is up to date on the required vaccines.
Oh, great. Thank you. Going into the same question about how to find vaccines, but if you're leaving for vacation and your primary care is swamped and can't get you in for a vaccine that you may need, is there anywhere else you can go to get travel vaccines before you travel or before you would need them?
Yes. So back to the primary care provider, even if they can't get you in, a lot of offices, ours, for example, will offer nurse visits where you would just go in for the vaccine. Pharmacies now give vaccines, and it's really a nice, convenient resource. You don't even always need an appointment. Now, they may not have specific travel vaccines, they may have just the routine ones that we're used to getting, but it's worth a phone call. I'm pushing for dentist offices to give vaccines, like HPV, for example, but specifically related to travel. Health department. So your local health department may carry a vaccine that you would need for travel. Depending on where somebody is going, they may consider a travel clinic where you would actually meet with an expert who would understand what the risks are with the associated travel and most likely supply and offer the required vaccines. And then if they wanted to do some research on their own, the CDC website, so you could go to cdc.gov/travel. And just there's a drop down box where you can click on the area to which you are traveling, and it will give you any precautions, what to pack, what types of vaccines to get prior to travel. And it's important to do that in advance because certain vaccines, for example, hepatitis A, in order to complete both doses, which is a commonly recommended vaccine for travel, you would need 6 months before the time of departure. So to do research on their own is a good idea, and then consider the health department, a travel clinic, or a pharmacy.
Okay, thank you. This was a question I had, but I was recently on a medication that recommended I stay out of the sun while taking it. And so if I or anyone else were to get a vaccine during the summer, does it work the same way? Do you have to stay inside? Do you have to plan to not have a beach day? Is there any sort of relation to that?
Yeah, great question. To my knowledge, no, there are no vaccines that would cause photosensitivity or sensitivity to light or sunlight. There are indeed medications. Certain antibiotics can put people at risk for a rash if they're in the sun, especially without sunscreen. There are other precautions with vaccines. So we talk about precautions and contraindications. Precaution is really just a temporary warning or area to be cautious of before giving a vaccine. So that would be if somebody's pretty sick, perhaps if they're pregnant and you don't want to give them a live virus in the vaccine. A contraindication is if somebody had a true allergic reaction to a previous vaccine dose or a component of the vaccine. So I'm not aware of any precautions with sunlight with vaccines, but there are other conditions that we would look for. And that's why prior to giving any dose of a vaccine, there's a vaccine information statement that we give to parents or patients that kind of goes over a checklist. And we're sure to be cautious if there's any reason not to give the vaccine on that day.
Great, thank you. That was super interesting just for me. I wanted to understand vaccines and all of that. But
Sure.
do you have any recommendations for how to gather large families or large groups this summer? Anything that you can recommend guests do before coming? With it being outside and warm and the ability to spread out, are the recommendations different from when we would gather like over Thanksgiving or Christmas?
Sure. I think we've all learned many things through COVID, but I think one of the big things is if you're sick, stay home. I think before COVID, especially in healthcare, people would come to work sick all the time because you felt this duty and to be there and not leave things for your colleagues. But I think we've all learned it's very important if you're sick to stay home, especially if it's a large family gathering. Perhaps there's a baby there or an older adult who might be more vulnerable. Hand washing, that's the other common sense thing we've learned. So if you're preparing food, if you're going to be getting together in a large group, even if you're outdoors, wash your hands because people are going to be hugging and kissing and shaking hands. So I think that's important as well. I think it's just really common sense. And I don't know that I would change anything just because you're outside, because if it's a family gathering, there's still going to be some close contact there.
So speaking of like babies and children, if you're going to be around a newborn and you're asked to get this RSV vaccine, but you're under 60, is that something you're able to do? Especially if RSV peaks in the fall and not so much the summer, is it something you should do in the summer or that can be repeated in the fall? Do you have any recommendations on this RSV vaccine?
Yeah, this is a new thing. When vaccines are FDA approved, they are studied in a certain age group, and many reasons for that. It has to do with the safety profile of the vaccine, the risk factors. So certain age groups are more at risk for certain conditions or viruses. So the recent RSV vaccine is FDA approved for age 60 and older because the risk of getting seriously ill from RSV goes up after the age of 65. So the goal is to protect somebody before they enter that high risk age group. With medicine and medications, we sometimes will use them, what we call off-label use. It might not be FDA approved for a certain condition, but we've learned that it can help. I guess an example of that would be maybe trazodone, which is an old antidepressant, but it made people tired. So sometimes we use that for sleep. The same is not true with vaccines. We have to stick within the FDA approval because of the studies that go into approving these vaccines. So no, an individual under the age of 60 would not get the RSV vaccine to protect the infant. The common sense things, if the individual has a cold or cold symptoms, stay away from the newborn. Really, the only vaccine that we really encourage close contacts of newborns to get is the Tdap, the tetanus, diphtheria, and acellular pertussis, because that pertussis or whooping cough protection is not there for newborns. They don't complete their series until way after a year old. And so we try to get adults protected to protect the babies from pertussis or whooping cough. Same is not true of RSV. Not yet, at least. We'll see.
And so you had mentioned a little bit earlier about some vaccines you need to get 6 months in advance. Is there a general schedule? Like when should you be scheduling or looking to schedule travel vaccines or vaccines before starting school or camps and things like that?
So every vaccine has a recommended number of doses and a recommended interval between doses. And so you would have to follow the minimum interval. If the schedule says somebody should get, let's use hepatitis B as an example, the first dose, 2 months later, the second dose, and then 6 months after the first dose, you get the third dose. You don't want to get them any closer than recommended. In general, it takes about 2 weeks after a dose of a vaccine to build an immune response. So if a vaccine is only one dose, for example, flu, for adults, they only need one dose during each flu season. You do want to get them that flu vaccine early in the fall because it's going to take a full 2 weeks for them to really mount a good immune response. And so you'd like to get them fully protected before the peak of flu season. So if it can be mid to late September or early October, that's ideal because then gives them the 2 weeks to mount that response. With a lot of the routine vaccinations, individuals will need more than one dose. And so Hep A, for example, with travel, if somebody comes in 2 weeks before their trip, and they can only get the first dose, there's some protection there, but it's not the full protection that they would get if they were able to get both doses in over that 6-month period. Sometimes you can shorten that interval. For example, Hep B, hepatitis B that I just mentioned, even though the first and second dose are 2 months apart, the minimum interval is 4 weeks. So sometimes based on studies and science, you can shorten that interval. And we do that when we're trying to catch kids up.
So can you get the flu vaccine in the summer? I know that's come up a little bit, but if if you've only ever gotten the flu vaccine during the fall and when it's pretty bad, should you be getting it during the summer?
So we see influenza all year. It tends to peak in the fall and winter. Each year, the flu vaccine is made based on the strains of the virus from the previous season. So this year, for example, we had what's called a quadrivalent vaccine. There were two of strains of influenza A protection and two strains of influenza B protection. So next fall, we'll have a new vaccine based on this year. It won't be ready in the summer. So the earliest we often can get the flu vaccine in the office would probably be September. We don't usually get it till early October. And it's true of most offices and pharmacies. Some get it a little bit earlier. So that's why it's not really offered outside of flu season, because then we start to make the new, I guess, variation of the vaccine for the following year. And keeping in mind that 2-week guideline, it takes about 2 weeks to build up those antibodies. Getting it in the fall is fine, because then you are protected when you expect influenza to be on the rise. If you were to get it earlier, say in the spring or fall of the preceding year, you're likely to get the old vaccine, which is fine. It just may not be as protective the following year, and you would most likely need another one in the fall when the new vaccine arrives.
So why does summer seem like a safer time in terms of like disease spreading and all of that compared to like fall and winter when we're thinking about like flu and RSV and COVID and diseases like that?
But as we mentioned, a lot of the viruses will have this seasonal variation. So we tend to see these viruses peak in that time period, perhaps being indoors, as you mentioned, perhaps being back in school. Kids tend to bring everything home. They're not as good with hand washing. I hate to say it, but a lot of kids go to school sick because parents are going to work. So that happens. I'd like to think that the vitamin D from the sun is helpful because there's some immune protection there. And just sleeping in and maybe eating more fresh fruits and vegetables. So there's a lot that just goes into lifestyle in the summer that may boost our immune response.
So going off of that, are there any recommendations you have for people during the summer to stay safe and stay healthy?
I guess if we're talking about kids, their sleep patterns are terrible in the summer. So I always counsel them to try and keep a consistent sleep schedule. I saw, I think, a 10-year-old in the office this week, and I asked about sleep, and she said, and during school, I go to bed at 10 and I wake up at 7. But in the summer, I'm on my phone till 2 or 3 in the morning talking to my friends. And so keeping a consistent sleep schedule, fresh food with farmers markets and gardens, a whole food plant-based diet really is the healthiest way to prevent illness, acute illness, but also prevent chronic disease and even reverse chronic disease. So with the availability of fresh fruits and vegetables in the summer, I think that's a great time to really be nutrient dense with our diet. Less stress. So there's more time to play and be outside and get fresh air. I mentioned vitamin D, maybe more positive social connections. I think if you study lifestyle medicine and the different pillars of lifestyle medicine, restorative sleep, physical activity, nutrition, positive social connections, stress reduction, all those things happen in the summer. The only one that might go up that's a risk factor would be substance use. So we really want to keep things like alcohol, tobacco, even caffeine down in the summer to really boost our immune system.
Wonderful. Those are all great recommendations. Thank you so much for all of your expertise and helping us understand how we can stay healthy during the summer.
Thank you for inviting me. This was a lot of fun. Thank you. You have a great summer.
Thank you too.